Hello everyone, welcome to MediMaps. So in this session we are going to dealing with bronchiectasis, another common disease in the respiratory system. Hope you have watched other videos of the respiratory system. In this session we will be dealing with the etiology, pathogenesis, morphology and complications of bronchiectasis. As an introduction, bronchiectasis is a permanent and abnormal dilatation of bronchi and bronchioles. So let's go on to the subtopics. Coming to the etiology, the causes of bronchiectasis can be classified into non-obstructive causes and obstructive causes. Under non-obstructive causes, we have post-infectious cause, genetic causes, and autoimmune causes. Post-infectious cause, that is, bronchiectasis can occur as a complication of many infections like mycobacterial infections, HIV infections, influenza viral infections, etc. It can also occur as part of some genetic causes like Cartagena syndrome and Young syndrome, and some autoimmune disorders such as rheumatoid arthritis also contribute to bronchiectasis. Now we have the next subset of cause, that is obstructive causes. Any kind of tumor, foreign body or mucus plugs can lead to obstructive kind of bronchiectasis. Now let's move on to the pathogenesis of bronchiectasis. The pathogenesis of bronchiectasis can be dealt in two pathways. That is the pathway coming from obstruction and the other one which starts from chronic infection. So coming to the first one, that is, an obstruction in the airways can lead to the impairment of clearing mechanism, and it would lead to the accumulation of secretions inside the airways. So these accumulation of secretions will lead to further infections, that is secondary infections, and it leads to inflammation, and finally it would lead to the dilatation of airways. Now let's deal with the second pathway. Any kind of chronic infection inside the airways would lead to increased bronchial secretion, and it will lead to obstruction of airways by secretions, and it will further lead to inflammation, which results in dilatation of airways. So this is the second pathway. So pathogenesis has been dealt with in two pathways. Now let's discuss about the morphology of bronchiectasis. Coming to the gross features. Of course, the most important point of bronchiectasis is the dilatation, and this dilatation may be up to 4 times of the normal lumen. Coming to the cut surface, in cut surface we have to deal with 3 points, that is, these dilated bronchi will appear as saccular, cylindrical or varicose shapes, and the wall of the bronchi will be thickened by fibrosis, and the lumen will be filled by thick and mucopurulent secretions. So these are the 3 points that we need to note in the cut surface. First one, it is that the appearance of the dilated bronchi and bronchioles. Next one is the thickening of the wall by fibrosis, and third one is the filling of lumen with mucopurulent secretions. Now the figure on the right side shows the gross appearance of bronchiectasis. It clearly shows the dilatations in a cut surface. Now let's move on to microscopy. In microscopy, we have to deal with the changes that occurs in bronchial wall and the changes that occurs in mucosa. Let's move on to the changes that occurs in bronchial wall. The first one and most important point is the dilatation of bronchi and bronchioles. The next point that we can observe in microscopy is the dense infiltration by inflammatory cells like lymphocytes and plasma cells. And the third point is the fibrosis. So we have 3 changes occurring in bronchial wall, that is dilatation of bronchi and bronchioles. Second one, infiltration by lymphocytes and plasma cells. And the third one, it is fibrosis of the bronchi. Now let's move on to the mucosal changes. So what are the changes that occurs in mucosa? The first change that occurs in mucosa is the desquamation of the lining epithelium of these airways. And the second one is the metaplasia of the lining epithelium. Lining columnar cells will be changed into squamous epithelium and also show pseudostratification. Now let's move on to the classification of bronchiectasis. Based on the shape of dilatation, bronchiectasis can be classified into 4 types. First one, it is called cylindrical type of bronchiectasis. In case of cylindrical type, the dilatations will be of uniform type. And then second one, it is fusiform, which is characterized by fusiform dilatation. And third one is saccular. In case of saccular, these dilated bronchi will end blindly in dilated sacs. And the fourth one, it is varicose type of bronchiectasis. In case of varicose type, they will be having irregular kind of dilatations. So we have 4 kinds of bronchiectasis based on the morphological features or based on the shape of dilatations. They are cylindrical type, fusiform type, saccular type and varicose type. Finally, let's move on to the complications of bronchiectasis. The major complications of bronchiectasis are lung abscess, pneumonia, septicemia, and meningitis. So with this, we have an overall idea about the pathology of bronchiectasis. In this session, we have dealt with etiology, pathogenesis, morphology, and complications of bronchiectasis. Hope you all have liked this video, and let's see in the next episode.